This film provides instructions on how to use Enstilar foam spray in the treatment of adult plaque psoriasis of the body and scalp. It's designed for use once daily over the normal treatment period of 4 weeks. Always use Enstilar as advised by your doctor and make sure to read the patient leaflet that comes with your pack. Before you start using Enstilar, shake the can for a few seconds. When applying to the body, hold the can at least 3 centimeters from the skin and spray onto each plaque-affected area. While you spray, you can hold the can in any direction apart from horizontal. A 2-second application delivers about 0.5 grams of foam, enough to cover an area around the size of an adult hand. Do not use more than 15 grams per day and avoid use on more than 30% of your body. Rub the foam gently into the skin. Before applying to your scalp, comb your hair to remove loose scales. Shake the can again for a few seconds. And this time, spray directly into the palm of your hand, still holding the can at least 3 centimeters away and in any direction apart from horizontally. Use your finger to apply the foam onto the affected areas and gently rub in, avoiding the hair as much as possible. Minimize applying into the hair to make it easier to wash out. A transient change in hair color in those patients with white or gray hair can occur when applied to the scalp. Replace the cap onto the canister to prevent accidental spraying when not in use, and wash your hands thoroughly, unless you are also applying treatment to your hands. This will avoid accidentally spreading the foam to other parts of your body, especially the face, mouth, and eyes. Try to leave the foam on the affected areas for a whole day or night before washing. To wash your hair, apply a mild non-medicated shampoo to the dry hair. It is easier to remove Enstilar when the shampoo is applied to dry hair, as water dilutes the cleansing effect of the shampoo. Massage the shampoo into the dry hair and scalp and wait for a few minutes. Then rinse your hair thoroughly with water. If necessary, repeat normal shampooing. Important information about Enstilar. If you forget to use your foam, take your next scheduled dose and then continue as before. Do not double dose to make up for a forgotten dose. Use Enstilar only on your psoriasis. Do not use on skin that does not have psoriasis. If you accidentally apply the foam to your eyes, mouth, genitals or breasts, if you're breastfeeding, wash or rinse the affected areas. Do not bandage or tightly cover the treated skin area. Avoid contact with textiles that stain easily, such as silk. There is an expiry date on the bottom of the can. Do not use it after this date. Use within 6 months of opening. Keep out of sight and reach of children. The pressurized container is extremely flammable. Keep away from exposed flame or other ignition sources. Do not pierce or burn, even after use. Do not smoke near the container. Protect from sunlight. Do not store above 30 degrees Celsius and do not freeze.